I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're talking about different procedures today. We've got breast augmentation lift.
Yes.
We've got gynecomastia. Post-bariatric surgery. We'll talk about that and let you know what that is a little bit later. And finally, otoplasty.
That's the plan.
What is that? We'll let you know. Before we get started, any advice we give you today, you want to consult your own physician first, but let's jump right in. Boom! Welcome back, by the way.
Thank you.
Thank you for being here with me.
Nice to be here.
It's always so much fun discussing these topics with you. First off, breast augmentation lift, very popular, but give us the, what is a breast augmentation, what is a lift? What's the difference there?
Sure, they both accomplish two different goals in rejuvenating the breast.
Okay.
So the breast augmentation is basically inserting an implant or adding volume to the breast to make it larger.
Okay.
A lift is to change the shape of the breast.
Gotcha.
Most commonly because it's saggy or the skin is loose or excessive.
Right. All right, so let's get right into the pictures because people love your before and afters, which they can always see on your website.
There's a few of them there, yeah.
There is a few of them there. All right, let's go to the first one. First one we have.
So this is had breast augmentation lift and also had a tummy tuck.
Yeah, I can see that.
The lift did not improve her belly, but we often do those together. But we've added volume with the implant, so the breasts are larger, a little more fullness, a little more cleavage up at the top. And then the lift allows us to redrape the skin over the breast so that it matches.
All right, so you did a combo here. Now, was this a mommy makeover per se? Because who's a good candidate for this?
So mommy makers usually are mommies because their breasts get larger and smaller with breastfeeding, and then their bellies get stretched out with pregnancy. But also it can be done for people who've lost weight.
Oh, okay.
Because that can accomplish or cause the same problems.
All right, good. And that's actually a very good after photo.
And this type of lift was around the areola, so we don't have that vertical component.
That's what because a lot of people, let's go to the second picture.
Sure.
A lot of people talk about the lift scars. Oh my gosh, I'm going to have scars. I don't want to get a breast lift, but they're really not that bad. Are they?
Well, they're there, and it's sort of part of the deal. If you don't want a scar, you don't have to have the surgery. I just can't do the surgery without the scar.
Exactly.
And there are some times when we just do a lift, or we don't do the lift, we just do augmentation. And the shape isn't quite as good. And then people will come back and say, yeah, let's do the lift.
Gotcha.
So then they can see what the benefit is more clearly.
All right, picture number two.
This is similar. So another mommy makeover. Just a little larger volume, and again with the periareolar lift. Periareolar lifts are great when the nipple doesn't have to be moved up very much.
Periola lift meaning
around
you're doing
the areola.
Gotcha,
so the areola is that pigmented skin around the nipple.
Okay.
When there's a really low nipple, then it kind of leaves a hole where we move it from. Then we want to close that hole, and usually if we close it vertically, it doesn't pull the nipple back down.
Gotcha.
So that's why we go to verticals or the anchor lifts.
So that was one of the periola lifts.
So this is a periareolar lift, allows me to bring the nipple up, and then the implant allows me to add the volume back.
Beautiful, very natural too.
Always the plan.
That is very good job. All right, number three, but I have a question before number three.
Okay.
Now, you're always saying we've got to replace these implants after 10 years. That was the old way. Is that still the way today?
Not so much. I think about 25% of women have a second surgery after 10 years or during those first 10 years. The most common reason is to put a bigger implant in, but also there's problems sometimes with the scar getting tight around the implant, which is called capsular contracture, or problems with the implant failing where it needs to be replaced.
Okay.
But I think that 10-year mark is really, it's a suggestion, something to think about before you do the surgery, so you know that there's a chance you're going to need another surgery.
Okay.
But if everything is soft and fine and the right shape and everything's good, there's really no reason to replace it as long as it's not broken.
Okay. Ain't broke, don't fix it. Picture number three.
So here's someone who had a vertical lift.
Yes, I see that.
So you can see that there's that pink scar running up and down. That does fade with time. She's probably about 6 months out here, so it's a little more obvious. If I go out too long, they're sometimes hard to see, so I'd like to pick a picture where you can see where it is.
Yeah.
And occasionally we'll also have to add an incision along the bottom in the inframammary fold, which that incision doesn't tend to bother folks because it's pretty well hidden.
Very much hidden. I don't mind that at all. That looks like it's going to fade very quickly because you don't really see the scar in the after picture anyway. And that was how many weeks out of surgery?
This is about 6 months.
Oh, that was 6 months.
So
see, that's
some
not bad
people,
at
the
all.
whiteness, that pinkness sticks around longer. Others, it goes away very quickly. Some, it stays forever. So there are other treatments where we can do lasers and such to try and fade the scar if it's not cooperating.
I mean, really, if you need the surgery done, you might have to deal with scars. It's not that big of a deal. I think people get a really
Well, in this case, you can see she has quite a bit of breast tissue.
Right.
And if we just put an implant in there, the breast is going to fall off the implant. It may not fall off immediately, but it will with time.
Right.
If we do the lift, we're kind of pushing it back up, gives us more time with a good result.
Beautiful. All right, final picture, and I want to quickly ask recovery time. Let's say you did aug lift together, which you can do.
Yes.
What is your recovery time?
Recovery is about the same as an augmentation.
Oh, really?
The lift
That's not
doesn't
bad.
tend to bother people as much.
Okay.
It feels tight because we've lifted, but the augmentation, normally I'm going under the muscle, which stretches the muscle muscle that tends to cause the most discomfort. Most people, the first couple of days, pretty sore. By the end of the week, feeling pretty good.
So not too bad.
Usually not bad. I've had people where it takes longer and others who ask why I scared them because they didn't hurt at all. But I think having a week to get better is usually enough time, unless you're doing a lot of heavy lifting.
Oh yeah, don't do that.
That takes a little longer.
All right, final picture.
So this is a breast augmentation lift from the sides. You can see we've got more fullness up at the upper pole of the breast, more projection behind the nipple.
Very much so.
And the nipple itself, obviously is in a higher position in the after picture because of the lift. There are some folks that have pseudotosis, which is a word for fake sagging.
Oh, really?
And those folks, everything's kind of bottomed out, but the nipple's still where it should be.
Yeah.
And often just putting an implant in will take care of that. We don't have to do a lift.
That. I've never heard of pseudotosis.
Well, that's a fun word.
That is a fun word.
There's a word for everything in medicine.
All right, now when you put the implants in, is there more fullness on the top? Because you see a lot of people that put the implants in and they look really tight and fake. These look really natural. Did you just get that?
I can make them tight and fake.
Oh, okay.
I mean, it's usually a matter of putting in a very high profile implant or too much volume for the body. But some people like that look.
Yeah, that's true.
And they'll request it, and then I'll put in what I think, I'll give an example of what I think is a normal volume.
Yeah.
And they're like, no, thank you.
No, I want to tighten.
Yeah, so we make it larger. And I think the saline implants sometimes do give us more of a round look too. So there are some folks where we'll choose to use saline instead of silicone because the silicone tends to be a softer result, so we can get more extra projection.
All right, sounds good. Thank you so much. For more information about Dr. Mealy, you can call his office, 925-943-6353, or check him out on the web, drmealy.com or sanfranciscobreast.com, where you can see all those before and after pictures. Very simple, very easy. Everything is right there. All right, we're going to talk a lot more about plastic surgery. Stay right there on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.